Let me explain subtyping to you. Subtyping is a way to bring multiple features together and then conflate them into very small groups. But patients don't present in that way. They present however they present, with individual features. To artificially slot them into subtypes, there are 4 subtypes. One is erythematotolangictatic, second is papulopustular, the third is phymatous, and the fourth is ocular. Now let me explain these to you. Subtype 1, erythematotolangictatic, comprises flushing, telangiectasies, and fixed central facial erythema. What if you only had one of them? Are you not subtype 1 then? Technically, no. Where do you slot them into then? You have no other category except papulopustular. But in papulopustular, it is based on the presence of centrofacial erythema and papulopustules. And what if you just present with flushing or telangiectasies? You would not belong to that group either. And then phyma was the presence of phyma, but it could be also associated with any of the other features, which means you could have subtype 1 and subtype 3, and ocular was the same, which means that ocular, subtype 4, could be ocular by itself or could also involve any of those other subtypes. So a patient with ocular rosacea, for example, could be ocular pure or ocular plus subtype 3 or ocular plus subtype 3 plus subtype 2. So this seems to me really confusing. And quite frankly, when we looked at the research that was done in populations, it was confusing also to other researchers. And one of the problems was subtype 1 and subtype 2 have very common features, for example, fixed central facial erythema. And we found that some groups combine the two populations and other groups would individualize and count them differently as different populations, which meant that you had different prevalences. But now that you conflate some groups and don't conflate other groups, you have no way of understanding true prevalence. So that was one issue. The second issue is that patients, remember, don't present this way. They present with individual features that can change over time. They don't necessarily stay with one subtype. They can move over time with more features. But we have no way of capturing that independently because, remember, these features are all conflated. Number 3, in clinical research, when we're studying rosacea, oftentimes if you have a medication that's looking at treating background centrofacial erythema and you're recruiting subtype 1, you would then also have to measure flushing, telangiectasies, and fixed central facial erythema. But there's no one treatment that can necessarily treat all of them. And even less so when we talk about subtype 2 papulopustular, which then requires a treatment that can treat both papulopustules as well as fixed central facial erythema. So it led to a lot of confusion, not just in terms of how we understand the disease, but how patients present, how we treat the condition, and most importantly, how to study the condition so that we can move forward with advancing the science. So in conclusion, what we've tried to do is to develop a features-based approach that we call the phenotype approach. And that approach takes away subtype from the lexicon, because I don't think that subtyping helps us advance the field of knowledge. What it does, it makes it more confusing and it sets us back in terms of understanding what to do in the future. So what we've done is we've looked at individual features, the 2 diagnostic ones, the 4 major ones, and then all the minor ones that are not individually diagnostic, and we put them into a group of potential signs and symptoms that may change over time. So we simply track it over time. And if we're doing research on it, then we capture patients with very specific individual features of rosacea. And that's what we hope to do with this new lexicon in terms of the phenotype of rosacea rather than the subtyping. So in conclusion, what I've hoped to show you is that what we're trying to do is to revise, update, and advance the diagnosis and the classification of rosacea to more clarity, less confusion.